borders. This conference is organized under the Slovenian presidency of the Council of the European Union to discuss how the EU can contribute to building solidarity, innovation, and resilience in health systems globally. To start the conference, I would like to kindly ask our Minister Janez Poklukar to welcome us with a short introduction to the conference.
Dear participants, dear ladies and gentlemen, I would like to welcome you to the conference of the Slovenian presidency of the Council of the European Union on the role of the European Union in strengthening health systems resilience globally. EU and its member states have an important role to play in global health due to its leading role in international trade, global and environmental governance, and in development aid. There is already a strong commitment in the EU and member states to take a leading role in global health in several aspects. Last year, we were very clear about supporting the leading and coordinating role of the WHO in global health. EU was also instrumental in proposing a special session of the World Health Assembly in November 2021. Its discussion would be dedicated to considering the benefits of developing a WHO agreement or other international instruments on pandemic preparedness and response. It is sometimes challenging to find a common voice of all member states in a short time frame, as pointed out already by previous presidencies. Therefore, we need to explore how to enhance existing mechanisms of coordination and how to support regular exchange of information. As well, we must strive for collaboration in establishing EU positions on health issues in a timely and efficient manner. The pandemic has further highlighted the need to better coordinate it in global health. One key challenge during the past months was ensuring global equitable access to COVID-19 vaccines and supporting COVAX mechanism. Slovenia, for example, has taken a decision to donate around 1 million of doses of vaccines and to contribute €500,000 to COVAX. Along with a fair distribution of vaccines, the continuous focus should be on strengthening health systems around the world to ensure health threats preparedness. We need to carry on with efficient health promotion and disease prevention, as well as the detection and appropriate timely treatment of communicable or non-communicable diseases. Investing in strong, resilient, and inclusive national health systems has been indicated as a crucial for sustainable development by the Pan-European Commission on Health and Sustainable Development. The final report was presented in September this year at the Regional Committee of WHO Europe. At EU level, there are already existing mechanisms and instruments to support the strengthening of health systems beyond EU and enhancing global health security. Still, more holistic, inclusive, and better coordinated action would be needed to seize all the opportunities to strengthen health systems globally. By closer cooperation, coordination, and active involvement of all relevant stakeholders, including civil society and non-governmental organizations, we would reach our goals faster. There is a lot of potential in creating partnership and networks of countries and all relevant stakeholders. They could provide support to strengthen health systems globally in terms of preparedness, capacity building, health promotion, health research and development, as well as digital health. EU member states have a long tradition of strong health systems and effective policies in many areas of health. Based on this, EU should demonstrate a strong post-pandemic leadership at global level and thus contribute to health equity internationally. We would build on this momentum and ensure our next investments in global health will be strategic and will lead to sustainable changes and resilient health systems worldwide. Thank you very much.
Thank you, Minister. Thank you for this introduction, for reminding us what we have done well, but also for pointing where the opportunities are for our work in the future. And now I would like to introduce our next speaker. Mr. Antoine Saint-Denis is a French delegate for European and International Affairs at the Ministry of Labour, Employment and Integration, as well as the Ministry of Solidarity and Health. Antoine, you have the word.
Thank you, Chair. Good morning, Minister. Good morning, ladies and gentlemen. Minister Olivier Véran had to announce to be with us this morning, and he asked me, as a Director for European and International Affairs, to share a number of introductory remarks with you all. We are clearly grateful to the Slovenian presidency to have convened this event on an issue which is not only topical, but key for our future. I would like to share with you a number of elements concerning the French strategy for global health that we had adopted in 2017 first. Second, try to draw a number of key lessons from the pandemic. And I hope and I'm confident that we will see why we need at this slide to develop a strong global health EU policy. In France, health has been an important focus in our international commitments for long. We have been very active for several decades in the fight against HIV, AIDS, tuberculosis and malaria, as well as the promotion of maternal and child health. And in line with the adoption in September 2015 of the 2030 Agenda for Sustainable Development, France had adopted a strategy for global health for 2021. Please let me share with you the 4 priorities on which this strategy is based. And as you can imagine, these 4 strategies were the result of a construction process shared with many stakeholders. The first priority is strengthening health systems while fighting disease. The second priority is about strengthening health security at the international level. The third priority is promoting the health of populations. And the fourth priority is promoting French expertise, training, research, and innovation. As you can imagine, all of these priorities are strongly linked to the Sustainable Development Goals. And the activities are based on the following principles. First of all, a right-based approach. Actions are characterized by defense of human rights, promotion of solidarity, expressed through universal and free healthcare, an emphasis on gender equality, user and community participation, and employment. Second principle, fairness and solidarity. The fight against inequality, whether social or regional, and the need to promote access for all to quality health services, and the need to implement universal health coverage are at the core of the daily actions taken to implement this strategy. Third principle, the reactivity and effectiveness, which means country ownership, alignment of national strategies and systems, and harmonization of donor actions and funding development based on results and mutual accountability. I reaffirm the importance of the support to universal health coverage. It's a key factor for development, and I think we have all seen during these pandemics how much the capacity of resilience of the different countries primarily relies on the existence of a universal health coverage. The implementation of this national strategy for global health relies on strong partnerships, both with the WHO, which is clearly for us the central pillar of global health, and the EU. We just launched a process for updating and upgrading this strategy for the upcoming years. Please let now me come to the lessons of the COVID crisis. This crisis has shed some light on a number of weaknesses and also strengths in our national, European, and multilateral strategies in global health. Furthermore, transitions, demographic, climate, environmental transitions, and digital transitions must be taken into account in what we have to build for the upcoming years and decades. Let's keep in mind, let's put in a central place the One Health approaches. It will be key for the future. We have in mind a number of lessons at the light of what we have been experiencing during the last month. First of all, we need to strengthen the multilateral health architecture and ensure a full and effective implementation of the international health regulations. In this respect and in this perspective, we must support the WHO's coordinating role in the preparation and response to health emergencies. We remain fully mobilized to ensure that the WHO and its emergency program arise stronger from this crisis, since the WHO is a central pillar of the global health architecture. That's why we are satisfied to see that there is currently a strong convergence on the setting up of a standing committee of the Executive Board on Health Emergency. We also need better and more sustainable financing of WHO, and the upcoming discussions at the G20 are key in this respect. We also need a much more timely and equitable distribution of countermeasures, namely vaccines, diagnosis, therapeutics. France has also been an active supporter of COVAX, and so has been Europe as a whole. But we need more. And a key challenge for the upcoming month will be the development of local industrial capacities in the developing countries, and not only in Europe and the United States. We also think that an important need highlighted by this crisis is the challenge of combating non-communicable diseases in a context of severe hospital tensions. We all know we had to face this, and we need to draw lessons from this. Relying on local preventive initiatives targeting the most at-risk populations and strengthening health literacy are decisive priorities in our view. I would like to add to this mental health. Mental health is critical. Mental health has been challenged by the pandemic and needs our attention, especially for young people, especially for vulnerable populations, but not only. In France, in Paris, we recently hosted the World Ministerial Summit dedicated to mental health last 2 weeks ago, in fact, which was organized in close collaboration with the WHO and the Alliance for Mental Health. And we do hope that the very knowledgeable discussions that this summit holds will draw some perspective for the next steps. And last, I would like to add as a need the training of health professionals. This is why we were already aware of this before the pandemics, and the pandemics has shown how critical it is. And that's why we have made it possible the creation of the WHO Academy in Lyon, an academy which is to become the benchmark training structure at the global level for global health professionals, but also for executives, business leaders, and for the civil society. This academy intends to develop innovative teaching methods and a system for validating prior learning throughout the course life. And we do hope and we will support the fact that the WHO Academy will soon train millions of learners around the world in the major themes of global health, like management of health crises, first aid, care for vulnerable populations, and specific health policies. It's a great step towards achieving the objectives of the WHO Global Health Action Plan, the so-called triple billion. It's clear, and this is my concluding point, that we need a strong and ambitious European shared vision and strategy in global health. It's certainly important for our credibility on the global stage, but it's also important to ensure the protection of European citizens' health and to guarantee some stability and security. We could see with these pandemics that global health is no longer only an issue for development policies. It has also become a domestic issue. And that's why we are extremely grateful to the Slovenian presidency to have gathered us all today for this discussion. I'm sure that it will be of a great value, and I can tell you that during the upcoming French presidency, we will be mobilized to facilitate the steps forward. Thank you very much.
Thank you, Antoine. Thank you for sharing with us the French perspective and also French priorities, not only national but also international, and for accentuating the importance of health for succeeding with development goals, and also giving us a lot of inputs for discussion today. Let me mention only strengthening WHO, strategic approach, aiming to implementation, and not forgetting about mental health and training of health professionals, but not only health professionals, also civil society and other professionals that have an impact on health. Now I will come back to Slovenia. I would like to welcome Robert Kokal, Ambassador and Head of Department for Development Cooperation and Humanitarian Assistance at the Directorate for Multilateral Affairs and Development Cooperation at Slovenian Ministry of Foreign Affairs. Dr. Kokal, the floor is yours.
Excellencies, Honorable Minister, dear colleagues, ladies and gentlemen, it is indeed my pleasure to participate at today's important event. Thank you for inviting me and letting me share the development cooperation side of view on the strengthening of global health systems. The EU has to play an important part in global health due to its leading role in international trade, global environmental governance, and development cooperation. As already highlighted by the distinguished ministers, Mr. Poklukar and distinguished French delegate for European and International Affairs, Mr. Saint-Denis, COVID-19 has once again underlined that we can only deal with the global health crisis or other international crises if we do it in an inclusive and coordinated way. With the Team Europe approach, which aims to tackle the health crisis while taking its social and economic consequences into account, the EU showed its strong commitment to fight COVID-19 in a coordinated way, not only within the EU, but also outside of the EU in the partner countries. One example is the €1 billion Team Europe initiative on manufacturing and access to vaccines, medicines, and health technologies in Africa. This initiative aims to create an enabling environment for local vaccines manufacturing and tackle barriers on both supplies and demand sides. Another example of the past months has surely been the distribution of vaccines outside of the EU and the Team Europe contribution of €3 billion to support the COVAX mechanism. However, the availability of vaccines, especially in our partner countries, is still an enormous challenge. EU member states have to further collectively intensify their efforts and provide their fair share. As already pointed out by our health minister, Slovenia alone has so far donated more than 500,000 of vaccines doses and also contributed to COVAX. As holder of the EU presidency of the Council, Slovenia is in the grateful position to facilitate important health discussions around COVID-19, but also beyond. Here we can build on the former efforts of the EU and its member states. Along with a fair distribution of vaccines, the focus should be on strengthening resilient and inclusive national health systems around the world to ensure health threat preparedness, efficient health promotion, and disease prevention, as well as the detection and treatment of communicable and non-communicable diseases. With regard to the development cooperation sector, we have put a focus on water and its links to global health. One of our first Council presidency events was a high-level conference on health and water. Therefore, please allow me to stress this important link for global health again. Throughout the Council presidency, Slovenia has promoted the importance of water not only for the achievement of SDG 6, but also as an important condition for the success of SDG 3 on health and the 2030 agenda as a whole. We have constantly emphasized the necessity of a safe access to water and sanitation for all, with regard to the overall COVID-19 response, but also for several other health-related challenges that we face today. Furthermore, water interventions in the health domain can have various positive effects on the promotion of gender equality. For instance, the lack of access to water and sanitation services for healthcare facilities around the globe constitutes a broad range of health challenges, including higher levels of maternal mortality and the spread of infectious diseases. Finally, ladies and gentlemen, excellencies, let me conclude that the current health crisis can also be considered as an opportunity to rethink global health innovation, governance, and collaborations. No one will be safe until everyone is safe. Therefore, is right now the time to strengthen our joint efforts. Thank you.
Thank you, Dr. Kokal. Thank you for sharing perspective of Slovenian ministry with us and being very concrete and sharing with us also some examples of good practice in international cooperation. Thank you also for accentuating the importance of clean water for health. And now I would like to give the word to Ilona Kikbuš, founding director and chair of Global Health Center at the Graduate Institute of International and Development Studies in Geneva. She has supported the Global Health Initiative in several consecutive presidencies of the Council of EU with her knowledge and experience in global health as well as health diplomacy. Let us now listen to what she wants to share with us on the role of EU in global health. Please.
Thank you very much, Vesna. Good morning to all participants, ambassadors, ministers. I'm delighted to be able to share some thoughts with you. Of course, listening to the presentations we've already heard is very interesting, and you will see that some of the points come again in what I want to share with you. And therefore, it is reassuring that this kind of thinking has really entered, if I might say, the mainstream over the last years as we have been pushing for more global health activities of the European Union. I'm trying to, it's not moving. I'm sorry, my presentation is not moving. I'm lost. Can somebody help, please?
Dajte mi glasno. You should push, there is the arrow that you should push with the bottom. Do you hear me, Lona? There is an arrow down there to be used.
Down where?
Left corner, down. Can you see it?
I've pushed the arrow, it doesn't work. I apologize.
We are trying to sort it out. We are trying to sort it out, yes.
I knew this would happen.
Well, it happens sometimes. Okay, it works now.
Wonderful,
okay, perfect.
wonderful.
Okay,
so,
sorry, Lona.
I will continue straight away. Some of these issues have been mentioned by the previous speakers, that the shared crisis experience, of course, has triggered extraordinary action from the side of the European Union in health. And we've just mentioned some of the global actions here that you are well aware of, but that sometimes even don't get enough attention. The very strong support of multilateralism and global cooperation, particularly of the World Health Organization during the Trump years, the Rome Declaration together with the G20, of course, the support to Act A and COVAX. We've heard about the production support to Africa, and in particular, the suggestion and advancement of a pandemic treaty, an issue that will be discussed at a special World Health Assembly later in November. Many of these coordinated actions have been taken as Team Europe and have brought together the Commission, the European Council, the political actors, and of course a whole range of member states. But, and we heard it from one of the speakers, global health is also domestic. and it's also European. And therefore, what has been really important is this move towards a European health union, where we have seen suggestions for major improvements in European public health, a new combination of the agencies, ECDC, the European Medicine Agency, and of course, the new approach towards what is called HERA. We've seen a major strengthening of health within the EU for the civil protection mechanisms and a whole range of other initiatives that would be too many to list here. What's important, and also the issue of values has been mentioned by previous speakers, is that again and again there is a call that the European actions in global health be value-based. And I took some of the statements from the EU G20 Health Ministers Global Health Summit, where you can see how this is reflected. The notion of solidarity, solidarity for health and for health systems, the notion of equity, and the commitment to a multilateral approach. Also within multilateralism, that the EU stands for a leading and coordinating role of the WHO. And we must see clearly that this is not matter of fact, even now that some of the political coordinates have changed. There is, and this links to the solidarity and the social contract that many people are calling for, the call for universal health coverage. And within this, the need to promote resilience of health systems, but also of communities. Because of course, universal health coverage isn't just a system of services, it's a societal system that brings communities and health services together. And what we have seen in the crises is the increasing importance of trust in governments, of trusted governance architectures, so that people trust the information, that people are willing to share data and scientific knowledge. So these areas that stand both for concrete action, but also for the values that we need in global health and have signed in so many declarations, are absolutely central. And here, of course, there is also a tension within the European Union and between the European Union and other actors. You can see here one of the statements by the President of the Commission, which says quite correctly that the scale of injustice and the level of urgency in relation to vaccines is absolutely obvious and is, she says very correctly, one of the great geopolitical issues of our time. And all the other issues of values and multilateralism fall into this. And here, of course, there is a major tension between, on the one hand, this strong commitment to multilateralism of the European Union, and on the other hand, the stalling of the negotiations at the World Trade Organization in relation to a TRIPS waiver. So we can see how internal and external politics, how health politics and trade politics, how health politics and IP politics sort of integrate around global health. And that is why it is so important to work on a European global health strategy, to take clear positions in how one wants to move these issues forward. As you well know, the European Union has been absolutely central in promoting the importance of a pandemic treaty. I already indicated that decisions on that will be taken at the end of November. There is a great difference within the global health community whether negotiations on such a treaty will proceed. This too falls into a whole range of geopolitical differences. and differences within the G20 and the G7 negotiations underway right now. And it will be absolutely central that the European Union is able to mobilize the support for such a treaty in about 6 weeks' time. We've mentioned universal health coverage and health systems, and of course, because of its value-based approach and the approach within the European Union and universal access in many European Union member states, this has been a central dimension of all global health work of the European Union. And of course, that has been also reflected in a range of political strategies that the EU has also supported, but where we feel it could still do more to ensure the implementation. And I refer particularly to the UN Political Declaration on Universal Health Coverage, the Astana Declaration on Primary Health Care, and of course, as initiated by the European Union with strong support then from many other countries, the focus and on the importance of health systems in the 1920 WHO resolution and the Rome Declaration. There's been a lot of financial support by the European Union to health systems building throughout the world. We have heard about the very strong development support that has been given. And of course, there has been significant knowledge sharing through a whole number of networks that have been very critical, particularly also the Commission support to UHC 2030. So I think we sometimes underestimate, at least the world underestimates, how much the EU and its member states are important funders of global health, of health systems, but also of many other initiatives that relate to global health. And you can see here some of the key dimensions of the Neighborhood Development and International Cooperation Instrument, NDICI, and Global Europe. And you can see, of course, that many of these initiatives relate to global health. Therefore, when we do speak of a global health strategy, a new global health strategy for the European Union, we see it clearly as a very intersectoral strategy that links it to climate change. We heard about One Health earlier on, that links it to digitalization, to education, and of course, to many of the social issues like jobs, growth, and trade. And therefore, I've listed here some of the elements that should appear in such a European global health strategy. The link to the Green Deal, link to development finance rethink, as people call it, and the need that the European Union could take the leadership on how we introduce global public goods financing for global health, particularly for pandemic preparedness and response. I've spoken about the need for new types of trade agreements that need to include health, the digital roles, the recovery support, and we know what some researchers call the importance of the Brussels effect. That is, when Europe sets standards, since it is a big trading power, even the largest trading power, then these standards become important globally, and this can be an important contribution to global health. So within that complex, the universal health coverage commitment of the European Union is absolutely central, but it needs to marry UHC and preparedness and resilience in new ways. And I'm sure that Martin McKee will speak about this much more, that we need to think systematically about improved pandemic preparedness within health systems and how public health in particular is strengthened as a key measure of preparedness. The weaknesses have already been mentioned by some of the other speakers, but I do want to highlight here that we saw clearly that public health systems were severely understaffed and underfinanced and lacked coordination, both within countries, within Europe, and globally, that the supply chains were exposed as a weak point, and that the global equity issues came to the fore in a way that we had not really expected, even though researchers have warned us for a long time how inequitable the global health situation is. So within such a new global health strategy, this changed global landscape needs to be taken into account. That we need to see that the new strategy has a renewed emphasis on investments in public health and primary health care, that we work more on one voice. One of the other speakers also referred to it, of the Global Health Team Europe, and also the representations in Brussels, Geneva, and New York that should become stronger for global health, as it is much more of a geopolitical issue than it has been before. And we feel very strongly that all discussions of a European Health Union should include a strong global health pillar. That, of course, will lead to an increased pandemic preparedness and health security, which has very much been the focus of the discussions of the European Union, of the support to WHO and its emergency program, and its support to many of the low and middle income countries. But here we need to move forward, we need to be strategic, and we need to be reliable, a trusted partner for the world. So health needs to be positioned in this wider discussion of socioeconomic movements of the European Union, and needs to be a focus also of the next generation European Union. And it needs to become easier to actually understand, see, and discuss which of the activities of the European Union impact global health, both positively but also negatively. So for future EU engagement on global health, universal health coverage, and health systems globally, we call strongly for the strategic priority of a new EU global health strategy. And we have heard from France that they are very ready to take this forward from the Slovenian presidency. We need global action on investment in resilient health systems globally. And in my view, a global pandemic treaty is part of such an investment and would strengthen and codify such investments. And we need coherence. We need to strengthen multilateralism in health. We need to strengthen the World Health Organization. That is probably one of the greatest challenges and tasks that the European Union and its member states have right now. We seem to be in a situation where the combined thinking about global health is not strong. There is a decoupling of positions of BRICS countries on the one hand, the European Union on the other, and the United States. And therefore, one of the key challenges, and hopefully the work on a European Health Union strategy, a global health strategy, will contribute to that, to end the fragmentation in global health, to end the decoupling in global health, and to bring the global health actors together around common values. Thank you very much. And sorry for the problems earlier on.
Thank you, Ilona. Thank you for referring to opportunities such as Team Europe and European Health Union. Yes, it is amazing how much health nowadays is discussed at international political fora, but not beyond health also. You were also very clear where we should invest in the future, including building trust. I think this is really important. Partnerships and adopting a strategy in EU, and make sure we invest in its implementation, of course. During our presidency of the Council of the EU, we have decided to put more focus on strengthening health systems in particular in the EU as well as globally, since strong health systems are the basis of strong preparedness for future health crises. Having this in mind, we have decided to ask Martin McKee to join us today and give us some additional insights how we can strengthen health systems globally. Martin is a medical doctor and professor of European Public Health at London School of Hygiene and Tropical Medicine. Martin is also a research director of the European Observatory on Health Systems and Policies and chair of the Scientific Advisory Board of the Pan-European Commission on Health and Sustainable Development. Martin, the floor is yours.
Well, thank you very much indeed. Well, thank you very much indeed. And can I begin by thanking you for the invitation to speak at this conference. I think, like all of us, life is quite busy at the minute, but it was obviously very difficult to refuse when Vesna asked me to participate. So I've been asked to talk about what needs to happen to make health systems more resilient in the face of a pandemic or another crisis. And that's something I've been thinking quite a lot about. Now, I want to start by maybe setting the background as to where I'm coming from. And I think it's really important that we make sure that we root our discussions at a European or at a global level in the experience on the ground. And for the last year and a half, I've been a member of a group of scientists, independent of government, independent SAGE in the UK, who have been seeking to interpret what's been going on in one country and really get to grips with the challenges that people are facing on the ground. And I have to be blunt, we have watched with dismay and some bewilderment as this country, with its vast reserves of scientific expertise, has managed to achieve one of the, perhaps the top ranking as the worst performing countries in Western Europe. And that has given us lots of experience to draw on. But we need to look more widely. And of course, I've also been involved, as Vesna said, in my role as research director in the European Observatory, where we established the COVID Response Monitor, a resource that has brought together information from how countries across Europe have responded to the pandemic. And if you're not familiar with it, I do hope that you will have a look. But following from this work, as Vesna has said, I was invited to join the Pan-European Commission on Health and Sustainable Development, invited by its chair, Mario Monti, and by Hans Kluge, the regional director for WHO. Now, this commission brought together an exceptional array of individuals, most of them from outside the health sector, to reflect on how we could build back better. We were really fortunate in having Mario Monti as our chair because he brought such a wisdom to what we were doing. So as you've heard, as well as being a commissioner, I also chaired the Scientific Advisory Board. And I do hope that you have a look at our evidence review, which sets out the basis for the recommendations, because I think it has a lot of material that you will find useful. And I'm going to be drawing on it heavily in this presentation. Now, I'm stressing the need to ground our recommendations at what's happening at the local level, but also to look at the international level. And I think it's really important to remind ourselves of the values of international comparisons, because although the virus is not confined by national or subnational boundaries, the policies are. And so we can look at countries that have done different things and fared differently in the pandemic. And just to take one obvious one that you're all familiar with in Europe, Sweden stands out from its Nordic neighbours on account of the significant problems it's had. And then, of course, we always look across the Atlantic to the United States because we have 50 states that we can draw on, divided between Republican and Democrat administrations and providing a rich natural laboratory. And here you can see how states with Republican governments were slower to lock down than those that had Democrats that were in power, which is not surprising given the highly partisan views of the pandemic among their respective voters. So these differences allow us to test hypotheses and to explore the ability to predict success and failure. And this is an area that we've had much to reflect on. But I'm putting this slide from the United States up because it reminds us that fundamentally resilience has many elements, and one of them is political. And as Rudolf Virchow taught us in the 19th century, we cannot ignore the politics of public health. Well, in 2019, before the pandemic, a team in the United States developed the Global Health Security Index, and that ranked the countries of the world in terms of their preparedness for a pandemic. Now, it focused on the scientific and the technical capacity, including surveillance systems, laboratories, and research expertise. And the United States came out on top, the United Kingdom came second. But of course, as you know, the reality is very different. Now, I stress that this is not a criticism of this index. I think it's actually a very valuable index. The point that I keep coming back to is that you can have all the technical expertise, you can have all the preparedness, but that doesn't get away from what happens. It depends so much on who you have, who is leading the response. So before we decide what we need to do to build resilience, to prevent and respond to another pandemic, maybe we need to go back and reflect on what worked and what didn't work. So as I've said, scientific expertise is important, but it's not enough. What do we need? Well, we have developed an analogy that we think works. Countries going through a pandemic or any major health crisis are a bit like a fleet of ships in a storm. Now, anyone going to sea knows that there's always a risk of being caught up in a storm. You do what you can to avoid it. You look at the weather forecast and you avoid going to sea if it is choppy, but there's always a risk. But crucially, you prepare well. But if you spend your life at sea, the question is not if there will be a storm that you'll be caught up in, but when. So what do you need to prepare yourself for that storm? Well, the first thing is that you need the best captains that you can get for your ships. Now, these should be people who understand the sea and the weather. You don't want someone, if you're an American, for example, who believes that you can treat an infectious disease by somehow getting bleach or ultraviolet light inside your body. And you want your captain to be paying attention if, for example, you live in the United Kingdom. You don't want them to be focusing on how to leave the Sea Captains Union or leave the fleet, or sorting out their complex personal life. You want them to be concentrating on the storm and how to get through it. You want the ship to have a sufficient, well-trained crew. When the wind is howling all around you, it's not a good time to be calling outsourcing companies to ask them for extra staff. And you don't want to be recruiting people with no relevant expertise. Take contact tracing. Contact tracing is a complex task. And anybody who works in a tuberculosis or sexual health clinic will know it requires the skills that we would normally look for in an accomplished detective, asking people probing questions about their personal lives. It's not a job for call center workers, no matter how dedicated they are, who would otherwise be engaged in direct marketing. And you want the crew to be working together, so you shouldn't build fences on your ships to keep them apart. And similarly, you would hope that nobody would create barriers that would prevent people in different parts of the health system, in primary care, in secondary care, in public health, from speaking to one another. You want your ships to be seaworthy. You would hope that there were no holes in the deck through which people might fall into the sea. And similarly, in a pandemic, you would hope that the safety nets that prevent people from falling through the gaps remain strong and haven't been eroded by austerity policies. And it's particularly important in some countries whose economic model since 2008 has been dedicated to policies that leave people leading precarious lives. Governments that are pursuing low wage, low productivity economies based on informal employment. These governments have left far too many people not knowing from one week to the next whether they will have a job, whether they will have income, whether they will have shelter, or whether they have food. And that has undermined the resilience of their pandemic response. And of course, you want ships that can communicate with one another. You would not want to switch off your radio, nor would you allow yourself to get into a situation where you're not exchanging information with your closest neighbors, because you know that if you did so, you could end up looking very silly. For example, and to take one concrete example, if you make a simple mistake that involves putting one of them in the wrong category and you have no means of checking with them, And of course, this was exactly what happened when the United Kingdom put France on a special list for people coming from France. They simply misinterpreted the data. And you want to look out, or in pandemic terms, you want a surveillance system. And this needs to be really strong. Countries that have failed to invest in such systems have been weakened. And here I would pick out in particular genomic sequencing. I live in the United Kingdom. It has done many things wrong, but it has done a few things right. And it is really doing a world-beating job in genomic sequencing. But far too many countries in Europe are not, unfortunately, and that's a real challenge. And finally, you need to have the right chart. Like much of Europe, but right across much of Western Europe, we were all working on a map that had written at the top of it the word influenza, when we should have done what countries in Eastern Asia did and pulled the chart marked SARS out of the map case. So I hope that these examples show that there's much that countries in Europe and worldwide could have done better. Many of the countries were not prepared. And it's particularly surprising given that many of us did have so much scientific expertise, and also because we were warned. And even in some cases, we had undertaken exercises that exposed our weaknesses. Now, I just want to digress a little bit to say it's not all bad news, because there are some things that have worked really well. We have had the development in record times of new vaccines, Oxford, AstraZeneca, Pfizer-BioNTech, Johnson & Johnson, Moderna, and others. We've had the recovery trial, which has told us what works and importantly, what doesn't work, Open Safely database and other examples. So our scientists have not let us down. Well, so far I've focused on what can happen, what should happen when a pandemic happens, but let me just step back a bit and remind us that we need to take a really broad perspective to all of this, because a pandemic is only one of many threats that threaten the survival of our species. And there are many others. And in some, the causes are outside our hands. There's nothing we can do if an asteroid is on track to collide with the planet. But there are so many things where the things that we are doing are increasing the risks. And there are also many things that we can do to reduce those risks. And I think that's where we need to look at the positives and the negatives. And that's something that we have done in this diagram that I'm particularly pleased with. It's one that we developed in the evidence review and subsequently in the Pan-European Commission. And we've been reading a lot about the different threats to humanity. So this is what has come out of it. We place a really high priority on One Health, right at the center. The health of humans, animals, the environment, microorganisms, all interacting. Now, I think everybody now agrees that COVID was just the latest in a long list of infectious agents that jump species. And even if we don't know precisely what happened in Wuhan, it does seem likely that it was the result of changes in our behavior, bringing us into close proximity, almost certainly in this case, with bats. But as we go back through history, the list includes almost all of the microorganisms that now currently affect humans, from measles in the Neolithic period to HIV spreading from primates in Africa in the early 20th century, and so on and so forth. So we then, of course, need to change the way we think about One Health. We need to think about all of the different elements that come together in this way. And then we need to look at all of the aspects, all the things we can do, the prerequisites for good health, going back to the Ottawa Charter, peace, food, shelter, and so on. New issues like working conditions and digital access to justice, as well as the new threats we're facing from corruption in particular, from organized crime, from racism, hostile and hostile artificial intelligence. We really also need to look at the role of biodiversity in being our ultimate insurance policy. Now, given the time, I'm just going to go on quickly to some of the issues that we need to really focus on. We need to look at ways of healing the fractures that we can in our societies. We've seen how the virus was able to exploit those fractures, spreading rapidly through some of the poorest areas in our societies. We need much better data on people who are disadvantaged. And here across Europe, we really need to focus on data on ethnicity and migration status, because there are too many people that are effectively invisible from our data systems. We need to think again about innovation. We had a great success with COVID vaccines, and we have seen what we can do when research aligns with society's needs, but often it doesn't. So we need vaccines and medicines that make a real difference and not just me toos. And we need a true partnership between the public and the private sector. We need to invest in health systems, and some countries have consistently failed to do so. But it doesn't just mean giving the sector more money. We need to look at new models of care, and in particular, new ways of working based on multidisciplinary teams in which everyone is valued and not just physicians like me. And this will really only be possible if we can get the resources to do this. Now, we've thought a lot about how we can encourage, how we can create the conditions in which governments and international finance institutes are willing to invest. And we need to really get this message that health is not a drain on the economy, health spending. It is an investment, and a healthier population is more likely to participate in the workforce, and they're more productive. So we need to look at the rules that influence investment. I don't have time to go into it, but we've been talking to the IMF and to others, and it's clear that we're knocking on an open door. And we need to get stronger governance. Now, Ilona has already said quite a lot about this, but we're particularly keen to address this issue of sovereignty. Governments really guard their sovereignty jealously. I live in a country where they put sovereignty ahead of the ability to supply food to them at the minute. So, for example, but we were inspired by what happened after the global financial crisis, whenever the members of the G20 came together to say never again, and they created the Financial Stability Board to manage risk and ensure liquidity in a crisis. And that worked. We did not have a financial meltdown when the pandemic hit. So we have proposed a similar body for global health. Unfortunately, with Mario Draghi, the Italian Prime Minister, an academic economist, chairing the G20, we have a receptive audience. Also, we've talked a little bit, and you'll be talking more about a pandemic treaty, a vaccine policy, and so on. So I won't say more about that. So just to conclude, even if we cannot prevent another pandemic, we can strengthen our resilience, not just in health systems, but in society as a whole, whenever a crisis comes. And even if we fail, we can shorten the course of the pandemic and we can protect those who are most affected. But we will only do so if we learn the lessons from previous pandemics. And as we know, tragically, often our memories are far too short. So thank you very much indeed.
Thank you. Thank you, Martin, for sharing with us in such an interesting way where we have maybe done things wrongly, but also how much important it is to prepare to not repeat what has done wrongly, and to pointing to the importance of governance and, of course, decision-making at political level. This has a huge impact of how countries are performing when it comes to a crisis like this. Thank you also for pointing to innovation, which is very important, but we have to think long-term when innovating, and we have to change our ways of working, you also said. Your presentation was a very good introduction for our panel discussion on strengthening the resilience of health systems globally. Before presenting our panelists, I would like to invite all participants also to share your comments and questions in the chat function. I'm very happy to welcome at the panel discussion the following panelists: Christine Burling, Head of International European Affairs, Directorate General for Health, Ministry of Solidarity and Health from France; Björn Kümmel, Deputy Head of Unit Global Health, Federal Ministry of Health, Germany; Lydia Baudarin, Policy Officer, Directorate for International Partnership at the European Commission; Natasha Zopardi-Muscat, Director of the Division of Country Health Policies and Systems from WHO European Region; and Daniela Uroshevich, Chair of Southeastern European Health Network and its Executive Committee. In order to not lose any valuable time, I will ask each panelist a couple of questions. Please be brief and limit yourself to 2 or 3 minutes in your responses. However, all the panelists are free to contribute to any questions by raising your hand. And of course, let me remind you that this is a conference which is an opportunity for brainstorming, so you can share your thoughts more freely. I would like to start the discussion by putting a question to Christine. In the introduction, we have heard about the French national strategy on global health. Would you say that also at EU we would need a common strategy for all our member states for global health in the coming years? Christine.
Yes, well, thank you very much. I hope you can hear me clearly. Thank you very much, Vesna, for this great question. Yes, I would actually say so. The European level is the right level if we want to step up efforts aiming at a more ambitious global health agenda. So a strategic roadmap should definitely be prepared at EU level to build support and investment in common goods, such as more equitable health systems. I would like to point out that France shares a substantive proposal of the excellent Slovenian paper presented today, which called for broader implementation of universal health coverage and resilient health systems. We agree that the status quo is no longer acceptable and that we need to commit to bold action. As we prepare for the French presidency, we have identified policy areas where greater cooperation at EU level can generate clear benefits. And we need to build a common narrative in public health around those clear area beyond health security, I would say. Global health, of course, is one of them. So we need to act really now. And in this area, we really look forward to build on the British presidency to assert and EU as a major political mechanism to support that too.
Thank you, Christine. Not only strategy, but common narrative is important. I do agree here. Björn, Germany has launched a new German global health strategy in the last year. Germany is a federal country, so we had to get federal states around the table and involve different stakeholders learned during this process.
Yes, thank you, Vesna, for that question. Indeed, as you rightfully mentioned, Germany has, the German cabinet, so the ministers have adopted a new global health strategy just last year. It's now 1 year old. This was, I think the easiest act was the adoption through ministers, but the more difficult task was the process towards a global health strategy. This took us roughly 2 years, and we consulted with almost everybody we could consult with, be it in Germany, but even beyond Germany. We consulted with colleagues. We wanted to learn the lessons from others who have already written and adopted such a strategy. And we had lengthy, discourse processes with civil society, so with NGOs, foundations, obviously also the private sector. We have that in Germany twice every year, and we use this format to get really the input from civil society and stakeholders outside the government. And our main idea was to start off with that input. So rather than starting with a proposal coming from the government and then being discussed with civil society, we did it the other way around. We first asked civil society for their inputs and then brought it to the federal ministries, because otherwise we had thought that if the ministries had already decided upon specific priorities, then they might be rather reluctant to take on board all the inputs and reflections from civil society. So what I'd like to highlight is that the process towards a global health strategy is essential, because it more or less already explains which partners to involve, and you need not only to have something in writing, but rather you need the full commitment of the entire stakeholders and actors. And that, for that, this heavy process that we did in a very transparent way was essential to us. And I hope that answers your question.
It definitely does. This is a great example how you have to start such a process bottom up and involve civil society and the industry also. I think it's a very good example that we should maybe learn from when we embark on developing an EU global health strategy. It seems important to have such a strategy to define the goals and priorities. And there, of course, are already many mechanisms at EU existing to support health systems globally. This does exist. A more strategic approach could perhaps be helpful in using these mechanisms. Lydia, you are working at the Directorate for International Partnerships at the European Commission. May I ask you to give us a brief insight in the current landscape of global health at the Commission level?
Sure, thank you, Vishna. And I think the previous speaker, thank you to Ilona Bush and to Martin McKee for already having provided quite a good description. But it's true that the European Commission has been really engaged in the global health architecture in many ways. So one of them is obviously the support to global health initiatives, such as the Global Fund, Gavi, UNFPA supplies, but also obviously to WHO, notably to its Universal Health Coverage Partnership. But it is true that the COVID-19 pandemic has been an accelerator in our actions. For the immediate response to the pandemic, we called at the onset of the pandemic for stronger multilateralism and global cooperation. We have notably organized the Coronavirus Global Response Pledging Conference. We have set up new mechanisms which did not exist previously, such as the joint procurement mechanism in the EU, or we also have co-convened the ACT Accelerator. But beyond COVID-19, we're also committed to strengthening the global health architecture with more medium to longer term impacts based on the lessons learned from the current pandemic, as mentioned by several speakers already. And one way of doing this is to bridge specific identified gaps, such as the already mentioned Team Europe initiative on manufacturing. But beyond these targeted gaps, we're also very engaged in strengthening the global health architecture more generally. So, as it was already mentioned, discussions are currently ongoing regarding the pandemic treaty on how to strengthen the WHO. We are also establishing the HERA, which was already mentioned by Ilona Kickbush. And we're also strongly engaged in the current discussion in the G20 for the establishment of the Global Health Threat Board, which was mentioned by Martin McKee as well. We are also collaborating to the EU-US agenda for beating the pandemic to establish a financial intermediary fund by the end of the year. So to summarize, the European Commission is really strongly engaged in global health through global health initiatives, through bridging specific identified gaps which were identified during the pandemic, and through our involvement in the different global health fora to strengthen the global health architecture for better preparedness in response to future outbreaks and pandemics.
Thank you very much. It's very good to hear that there is so much already in place and could actually serve as a starting point for thinking even more strategically at the EU level. We have globally an important organization that is responsible for health. And last year, together with Germany and under their presidency, we have actually made it very clear that WHO has to be strong and that this is the organization that can support us in our endeavors to improve health worldwide. Natasha, looking from the perspective of WHO Europe, in which areas would you say Europe is already a key player in global health?
Thank you, Vesna. And let me start by really saying that we are very grateful that a number of countries and also the European Union, European Commission as a whole has strongly demonstrated its support for WHO during the COVID pandemic in particular. I think the number of speakers have already shown that Europe is really leading the way in a number of areas, whether this is through actions being spearheaded by individual member states, by the European Commission, or by the EU and WHO together. Of course, there has been the important contributions, for example, that have been made to COVAX, and this is really appreciated and valued. But I think that also the EU is making strides ahead with, for example, also the deployment of the COVID vaccine certificate, where we see now a number of countries that are seeking also to join. So that is a clear example of where, in a very practical and tangible manner, Europe has provided something that is now leading the way. But of course, there are other areas too. Let me mention, for example, the successful summit that was held by our colleagues in France just a few days ago, where again, Europe is really leaving its mark and showing that we need to put mental health very much at the heart of the recovery. Of course, I'm not going to go into a whole litany of projects that are being carried out together. We had a very successful senior officials meeting convened by the DDG in Geneva this week, together with a number of colleagues from various services in the Commission. But I think what has been made very clear is that during the COVID pandemic, the opportunities for the European Union and WHO to really collaborate and work together on the ground within countries, both within the EU and beyond the borders of the EU, have been manifold, and there are lessons that have been learned and that we need to take forward. Looking forward, definitely I see that there is a very important role for the EU to play in areas, for example, such as data and digitalization. The strong legal infrastructure that there is in the EU provides an important basis and sets a number of important standards. And I think one of the things that has really emerged from this pandemic is the need to step up our game when it comes to having timely, credible data available. And I'm sure also here that the hub that has been set up in Berlin will make an important contribution in this regard. Other areas where I think Europe is very much leading the way in collaboration between the EU and WHO, I will mention two examples. Our geographically dispersed technical centers of excellence in Barcelona and in Bonn. Between the Barcelona office and the European Union, there's important work taking place on financial protection and health as an investment, health as a contributor to economic growth. And also with our center in Bonn, a few days ago, we have published important work where we're very grateful for the support and leadership shown by our colleagues in the EU in the area of air quality. I think there is more opportunity where we can work together. I would refer, for example, to the massive investments that are going to be taking place now in a number of countries through the Resilience and Recovery Fund. And I think over here, there is ample scope to leverage also the WHO country offices and country presence on the ground to ensure that we really bring together the objectives of strong economic growth and recovery, and ensuring, however, that smart investments in health and health systems, particularly in those areas that have tended not to have the right levels and volumes of investment in the past, be they primary care or mental health or public health services, are really brought to the fore. So in summary, I think that Europe is leading the way, but I do feel that both us as the regional office within the One WHO, but also at the European Union, we do have a strong also responsibility to reach out to other regions and to leave also an impact globally. And there are a number of encouraging initiatives. We are also working with other regions on topics of mutual interest, such as the health workforce and migration, where obviously we have close contacts with our colleagues in EMRO and in CRO also. So I think we can look forward to continuing and stepping up our efforts in the coming months in this area. Thank you, Vesna.
Thank you, Natasha. Thank you so much for sharing with us where are opportunities for us, European Union and WHO here, working together and aiming also not just within to change things or to improve, not just within European region, but also more globally. Also, I would say it's very important that you shared with us where are opportunities where WHO could actually serve and support us in implementing within the countries with your technical support units there. This is really important, I think, because at the end of the day, what really matters is implementation. And when I speak of implementation, I will now turn to Daniela. Daniela is representing a network, a Southeastern European health network, where WHO, European Union and its member states and some EU candidate countries work together already. Daniela, can you share with us how did this work and what are the main examples of good practice in this regard?
Thank you, Vesna. Of course, hello to everyone, and it is my honor to be here and really great pleasure to represent the Southern Eastern European Health Network member states. Indeed, our network marks this year 20 years anniversary, and its progress and contribution to the health gains in the region is widely recognized. Network focuses its work on several technical health areas based on its centers of excellence and drivers of regional cooperation and development. Those are the regional health development centers in public health, communicable diseases, also non-communicable diseases, antimicrobial resistance, mental health, blood safety, and sexual and reproductive health. Of course, there is quality of the health services and human resources in the health, and this center is in Belgrade. Moreover, our network ministers have been meeting regularly over the last 2 decades to discuss matters of priority aimed at building the health system's resilience over the Southern Eastern European region. A particular place and agenda shapers that define network actions are the achievements of the 2030 Sustainable Development Goals and also European Union accession, as we have few countries of our member states that are members and also candidates for the membership to the EU. The political declaration of the universal health coverage and also Astana declaration on the primary health care strengthening also impacted the latest developments. And last, and definitely the most powerful, the COVID-19 pandemic reoriented the entire activity model to its origins back 20 years ago on the core and fundamental principles of solidarity and partnership. We have many examples of countries helping each other in the immediate geographic border and trans-regionally that proves that network shaped and improved over the years the communication channels and offer the right platform for exchanges, building trust and offering support to the most in need. Finally, the founding partner and crucial contributor to the network achievements is WHO Regional Office for Europe. WHO stood and stands right next to the network over 20 years and complemented each other in a partnership that flourished and built capacities at the core bottom of the health system. Principle as no one to be left behind and attain the highest possible level of health have been translated through the network work with WHO to outreach and improve quality of the health system services, strengthening capacities, knowledge and intelligence transfer, and shaping cross-national ties. And we very much appreciate and welcome our cooperation in many forms. It makes supplementing, of course, and complementing, and of course, accompanying our member states to fulfill their needs and better health for our population. Thank you very much.
Thank you, Daniela. Thank you for sharing these wonderful examples, how we together have contributed to strengthening health systems in a big area, actually, of Europe. We could say that networks like this one are a good example of how countries can work together in partnership and how networks can provide a useful framework for strategic collaboration over a longer period of time. Since the outbreak of COVID-19 in early 2020, the EU member states and European financial institutions, as Team Europe, have distributed 34 billion euro in support to partner countries in addressing the pandemic and its consequences. We all agreed that we have to further invest in the resilience of our health systems. Christine, is it realistic to expect that the Team Europe concept could be expanded beyond the pandemic in the area of global health and used for strengthening health systems also globally?
Yes, Vesna, don't hate me, but I will kindly ask first, who is aware and that the EU has disbursed 34 billion in support to partner countries to address the pandemic and its consequences? Where exactly has this been acknowledged? Are the citizens aware of this? I have given a course recently on the mobilization of Europe during the pandemic. One of the questions was, the people remember China providing masks to Italy, but then they just forget what has been the real input of Europe. So I strongly believe that we need to strengthen the communication of Team Europe first. The world has really has to acknowledge the tremendous effort of Europe and the European countries to build back the better health of the people worldwide. We've shared most of half of the vaccines that we import for Europe. It's tremendous, but the people are asking more and more. So before pouring more billion into global health, I think we need guiding principle. We need a clear pathway to impact. Otherwise, billions will not make a difference to people's health. We also need to request more transparency in the global organization, to request that the receiving countries are made accountable for the support provided, and that the progress towards universal health coverage is monitored adequately. Regarding the strengthening of the health system, do you recall that ACT-A, this Global Health Accelerator, has 4 pillars, 3 concerning the development of the countermeasures, and 1 on strengthening the health system. But this 1 pillar has raised no attention and remained largely underfunded. And yet, rolling out of vaccination needs the support of the health system. So we have the tool, but we really need to use them properly to really reach impact.
Christine, thank you very much. I think this is really important. And here we can clearly see that we need a strategy. And in this strategy, definitely we need a very important part, how to communicate with different audiences internationally also. This is so important, but definitely if we want to appropriately invest, we also need some support, some financial support there. Is there a need for better coordination at the EU level to also ensure more strategic approach towards global health in the future in terms of financing? And I would ask, please, Björn, could you give some answer on this question?
Well, my answer would not only be limited to the financing part, but overall, I think that Europe, while we are contributing, while we are trying to add to global health, I think it's needed to compare ourselves to other geopolitical powers, such as the US, China, India, Brazil, Russia, and let's see whether we are doing as well as the other ones in shaping global health. And while in some aspects we might be at the same level when it, for example, comes to financing, all EU member states together are obviously a top donor. But when we are looking at shaping global health, I doubt that that is the case. And I will give you a couple of examples for that. I think, I guess everybody is aware of the fact that within the next, I would say, half year, global health architecture will be reshaped, whether we like it or not. And that is already ongoing in Geneva through the debates on a pandemic treaty, but also outside Geneva through the debates on a new fund that might be created somewhere else in Washington or elsewhere. And is the EU really powerfully engaging in these discussions? And I would say yes, on paper, yes, the idea of the pandemic treaty came from Charles Michel, from the EU. But in the reality, if we are looking at how negotiations take place, I can tell you that the US delegation sits in Geneva with 10 people negotiating the treaty. Let's count the people who are negotiating in favor of the EU. I would say I see 2. So 2 versus 10. I'm not sure where the priority setting within the EU with regards to global health is well understood in Brussels or elsewhere. I think that's a clear strategic deficit that we have been facing and that we've been arguing against within the last years already. That the Commission and the EU delegation needs to understand if we want to play at the same level as others, we need to take also financial decisions, and that means positioning ourselves well in Geneva and elsewhere where we are negotiating these initiatives. And I think the other aspect that we shouldn't forget is the one that Christine was just mentioning, communication. I think that we can learn quite a lot from the other geopolitical powers. They might be contributing less than we are, but the world knows more about their contribution than about our contributions. So apparently we're doing something wrong here with regards to really setting our priorities well. I think that a strategy is needed, not only on goals and priorities, but I think that the one thing we might be fighting or discussing what are the right priorities and the goals, and we might be having different views. But what we need to be clear about is that our principles in the EU, we have the common principles. And I think there is a major difference between us and many other parts of the world when it comes to the principles, how we want to engage in global health. And finally, I think we, as I mentioned, there are good initiatives and good ideas coming from the EU, but often we are lacking to put them into the reality in the very end. And I think there's much we can learn from the US and others to really, use the normative power of setting facts. And I think the lesson to be learned is now, within the next 6 months, we can see how to play this. And to be honest, the EU is not a major player in there, at least up to now. From our point of view, we should do our utmost in order to position ourselves better, but currently we are not well positioned. I think that's the reality. Sorry for that bad news.
Thank you very much, Björn. Obviously, we do need a strategy, everybody agrees, but also we could and should look at opportunities that are already there. Should we maybe make global health another pillar of the European Health Union? Lydia, you can reflect a little bit on what has been said and maybe also answer my question.
Sure, definitely. So indeed, a pillar could be envisaged, but it's true that strengthening global health has been at the heart of our work, even if it's not structured around a specific pillar. And this is including in the European Health Union. So HERA, which was mentioned earlier, is a key pillar of the European Health Union, and one of its objectives is really to reinforce the global health emergency response architecture. We're also working on ensuring that the EU model experience and lessons learned are used for global solutions. So whilst in Europe the ECDC and EMA mandates are being reinforced, we're also establishing partnerships with the Africa CDC to strengthen the capacity to prepare in response to public health threats in Africa. And we're strongly also engaged in the discussion to establish the Africa Medicine Agency and ensure the European standards are also followed. And I think it's also important to mention that all this work is being done in parallel of our bilateral and regional health system strengthening programs. And as a novelty, and maybe to jump on the question you asked earlier to Christine, it's a novelty of our programming for this new multi-annual financial framework is we're jointly programming our actions with EU member states and financial institutions through Team Europe initiatives. And within this Team Europe initiative, the idea is really to have also joint communication strategy to make sure that the visibility that all our actions deserve are actually guaranteed. So although strengthening global health is not a pillar per se of the European Health Union, we have been strongly committed to ensuring that the EU is engaged and plays a key role in global health, notably through Team Europe, and obviously more work remains to be done both in communication, strengthening, and in the different global fora, and to put forward our engagement. And maybe just to add in, we have committed actually 46 billion through the Team Europe approach to fight the pandemic, and 42 billion have already been dispersed, and more efforts should definitely be done to ensure the right visibility on this. I think the same question and issue comes when it comes to vaccine sharing, to vaccine exports. I think there is a bit of a bad press also on what we have been doing, and joint efforts definitely have to be made in that field. Thank you.
Thank you, Lydia. Certainly a lot has been done, and it was a difficult time, and I think we were quite successful in many ways. But we all agree also that we could improve the ways we communicate what we have done in the future, and also we should and could improve our negotiation with other parts of the world when it comes to strengthening health systems in terms of resilience and strengthening all the capacities in terms of investing in health. There were already some practices mentioned, for example, South European, East European network. But Natasha, could you share with us some more examples, concrete examples, where WHO has worked together with European member states or European Union for the benefit of strengthening health systems?
Thank you, Vesna. And of course, this has been happening even before COVID. So, for example, you will find a case study in the policy brief drawn up by our colleagues from the European Observatory on Health Systems and Policies about the work that WHO did on the ground in Greece during the difficult times at the time of austerity and the financial crisis, where there was a strong focus on health sector reforms. But more recently now, with the important assistance that has been obtained from the EU, we have been working very much on the ground with our colleagues in the Eastern Partnership countries, where we have a project that is currently ongoing, also in the Western Balkans and the Central Asian countries too. Because we should remember that when we talk about the WHO European region, we really border on several other continents worldwide, and as we know, communicable diseases really respect no borders. So from my experience, and here I understand very much what Christine was saying, that coming myself from the health system sector, sometimes it is very difficult to sell health system strengthening as a concrete example for investment. And yet I think the one lesson we have all learned as we look forward, and yesterday, in fact, an important position paper on building stronger health security going forward, is that we must invest in health systems and health systems resilience. Having said that, as health systems persons ourselves, we must find ways of making this easier to measure, to translate, and to understand. And in fact, on the ground at the moment, we are working very closely with our colleagues from the immunization area. Because, of course, when we talk about really getting jabs into people, that requires a very sleek and smooth health systems operation. But we can go beyond that too. So, for example, when we talk about the need to strengthen primary healthcare, which will be one of the key priority areas in the Western Balkan roadmap, which our regional director, Dr. Hans Kluge, had the opportunity to present to ministers at the informal EBSCO last week. Again, here we really need to link this very much to specific outcomes, whether it's on NCDs and the need to link, for example, to hypertension and stroke, or to mental health, which is again an area which needs a huge investment of resources, so that we can build a better bridge between the investment in health systems and the outcomes. And for this also, I think our EPW measurement framework, which we are very grateful that member states adopted unanimously in a very short period of time, has also alluded to the fact that we have gaps, that our traditional indicators sometimes are geared at measuring things that may be less important than other emerging priorities for which we don't have the right measurement indicators. And this, to some extent, also hinders our effective communication when we come to be able to show what have we actually delivered, what has the impact been on the ground. So I think, of course, it's always easy to say that we need to invest more in better communications, but maybe also we need to take a step back and think about the indicators that we are using to measure, and whether we actually, in the countries that we are working, have the robust health information systems that we need to be able to measure the status now and the progress that is being made as we go forward. As WHO Regional Office for Europe, coming back to our key objectives, as you know, one of the key objectives in our European Programme of Work is really to leave nobody behind. And we have made it very clear that in the coming biennium, we really hope to have implementation of our Western Balkan countries strengthening health systems in the recovery period underway. And here, of course, we count also on working very much with our traditional trusted networks, such as the Southern Eastern European Network, with other networks where we are collaborating in the region, such as the CEI initiative. But it's also important to look beyond, to look at the Eastern Partnership countries, to look at the Central Asian countries too, because particularly, for example, when we come to the Central Asian countries, we understand that, of course, their geopolitical location also makes them very much in touch and in contact with other key actors and donors. And I think there are opportunities, however, because they are looking very much also at the EU, and we are working very much on the ground with our country offices and the EU delegations to really develop and craft the projects that we need, that serve both the goals and aspirations of those countries, but also enable the European Union to make effective use of the development aid that is being directed in those parts of the region. So I think, Vesna, that we have started, that COVID has really given us opportunities to put our foot in the door, so to say, but I would say that the door is ajar and there is an opportunity for us to have the door much wider open. Back to you.
Thank you, Natasha. Thank you for showing us how we could work together with WHO and use your technical capacities and to accentuate the importance of monitoring what we do. And here you are also strong. We should be able to compare and have indicators there to support us in doing so and see if we are in the going in the right direction. But you also has pointed to a roadmap for health and well-being in the Western Balkans. This is in a way a kind of strategic planning, you know, how we are going to improve in this part of Europe. Daniela, could you say a few words about the roadmap and how this will further underpin and enhance the work of the network?
Thank you very much, Vesna, and of course, Natasha, for especially emphasizing this very, very important document at this moment. It came at the right time, I think. This document, of course, is a strategic policy document to which commitment has been promised, and also is a mechanism to rebuild health system in the Western Balkans and closing the gap with the EU economies. WHO commitment through this document comes to marry many aspects of the health system resilience that needs particular focus underpinned with adequate financial support and adjusting the Western Balkans' needs for support aimed to reach European standards. Health is inherently linked to the economic, social, and environmental dimension of sustainable development. Action is urgently needed to address the widening health and sustainable development gaps between the Western Balkans and the EU, which place countries increasingly at risk of risking the progress that made before the COVID-19 pandemic. The main priorities of the Western Balkan Roadmap build upon 5 targets areas that are existing in the network regional health development centers. Those are public health, non-communicable diseases, sexual and reproductive health, human resources in health, and environmental health. The roadmap outlines the role of the WHO Regional Office for Europe and partners. Thus, the South and Eastern European Health Network, in a multilateral partnership with the WHO and EU, shall provide a safe space for dialogue and advice to guide collaborative sub-regional efforts. Moreover, network will contribute to the interagency collaboration as a sub-regional actor through joint advocacy, analysis, policies, coordination, and country area support aimed to synchronizing, finding synergies, and pooling efforts and experience across the Western Balkans, and taking the gains and experiences to the broader audience of the network member states. The roadmap's 10 high-impact actions areas and 17 reform initiatives are aimed to rebuild the economies of the Western Balkans and promote an environment in which people thrive in their communities and have their health needs met. Thank you.
Thank you, Daniela, for sharing us, how you intend strategically to approach developments in your region or in our region, so to say, based on common values, with clear goals, and also with already thinking of a concrete action. This is actually what we are after also at the global level. But before the final round, I would like to look at some questions from the audience. There were not many, but one is maybe important, really. How can the member states' national global health strategies, such as in Germany, in France, for example, be aligned with an EU-level strategy? Does this create challenge, and how can they be these challenges, how can they be overcome? I'll first ask, I think, Lydia, and then maybe the others can also try to answer these questions. Please, Lydia.
Thank you for this great question. And indeed, as I mentioned earlier, we are more and more working through a Team Europe, either approach or initiative. So our first reply to the pandemic was this Team Europe approach, and we have jointly committed 46 billion euros to support partner countries to reply to the pandemic. But also, as I said earlier, in our programming for the next 7 years, we are more and more working together with member states to have more alignment, to avoid any duplication and create synergies. So we have mentioned earlier the Team Europe initiative in manufacturing in Africa, but we have also established four other working groups to establish Team Europe initiatives on several topics. And there we are really strongly coordinating and working together with member states to ensure that we're jointly creating programs to support health systems, either at national, regional, or global level.
Thank you very much. Björn, do you have to add something to this?
Well, I think that Europe needs to understand that it can play and make a major difference also in shaping global health, well, within the next, months and years. But so far, it needs to, from my point of view, it needs to position itself better, and it really needs to learn what Ilona Kickbush obviously promotes as global health diplomacy. Set the priorities right, make clear that the EU has a strong voice and has a clear plan to follow. I think that we do have a plan, but often we are lacking to put the finances and priorities then following these plans. And I think there's much to be learned still, but there are major opportunities, so let's use them.
Christine, maybe you have something to add. You're also thinking of a global strategy.
Yes, yes, certainly. I think we have to see, I mean, additionality. There's no competition between the countries, a global health strategy and the EU global health strategy. We're all contributing to Europe. And when Björn say he sees only 2 people in Geneva, I would disagree, because I see 27 plus 2 from the European Commission. So it's important, we are coordinating ourselves, but what we will need is a strong narrative just to be heard as a group, as a whole group. And we need that our respective member states and countries agree to speak with the European Commission voice as well. I think it's more and more like that, but again, we have to speak up and say things and repeat things where we put the funding and why we put the funding, and let the world and the global health in the arena acknowledge this.
Thank you, Christine. Well, now we are approaching the end, but there are still some minutes left, and I would ask participants to, through the final round, try to sum up what has been said and give us some final messages. And this time I will start with Lydia. Lydia, can you give us some final message of this conference?
Thank you very much for organizing this conference, and I think this is very timely. I think global health has always been in our different agendas, but the COVID-19 pandemic has obviously boosted it and put it higher in the agenda. And I think with the new way of working through Team Europe, we see that we have opportunities to seize within the EU, to both at global level, but also to strengthen health systems more generally. I think we are seeing the first output of our work. We already see Team Europe as a key actor, for example, in the ACT Accelerator. We have the funding which are accounted for as Team Europe, the same for COVAX. We are jointly sharing vaccines. So I think that we have a momentum here that we have to seize all together and have a strong position in the global scene. Thank you.
Thank you, Lydia. Daniela, what would be your final thoughts?
Thank you very much, Vesna. It is very, very difficult because at this moment I heard a lot of interesting things, of course, and we are all aware that there are no borders in Europe anymore, especially when we are speaking about pandemic. And I want only to emphasize that the most important thing at this moment is really strengthening the coordination between all the countries in the region, of course, and beyond. It is not a matter if some of the countries are EU member states or not. It is very important to do together, to have all policies on the ground, and of course that this implementation of all these policies will come timely at the same moment. So I think that we should work more tight, and really it is very important, as you mentioned in your document, to form a team of Europe, but not just with the member states. And I think that all other countries, I think that our colleagues from the WHO region office will agree that it is very important to have this Team Europe all on a board. So it is from my point of view, having in mind this situation and the things that happened in the last year and a half to all of us. Thank you.
Thank you, Daniela. Natasha, you have the floor.
Thank you, Vesna. I was really intrigued when you first asked me to join this session, and I was wondering very much, but what can I contribute as WHO Regional Office for Europe? And I think you have really given me the answer during this session, that WHO Regional Office for Europe, through our GPG, where Dr. Hans Kluge sits, through the work that we are being encouraged to do interregionally, through the work that we do with the countries beyond the EU on the ground, is really in a very, very unique position to help both the EU to advance its global health ambitions, to continue to support our member states, and to act as a natural port of harbor for this dialogue, which is often not an easy dialogue that needs to take place. So I think on behalf of my regional director, I reiterate once again, the door is open and please do not hesitate to come and to use us. Thank you.
Thank you, Natasha. Christine, what would be your final message?
Final message, a positive message, because we are collectively doing a tremendous job, and this has to be acknowledged. I didn't want to sound too negative during this panel discussion, and I hope I didn't misunderstand my main messages. I think it's important to recall that multilateralism is at the core of the European identity and of the European engagement with the world. And this is a very strong word, multilateralism, because again, as Björn was saying, we are reshaping the global health, and we do hope that it will go in the right direction. Also, Europe has a distinctive voice in the global health arena, but it needs to be heard clearly. And for that, I think we need now a very powerful common narrative, which should be aligned with our fundamental principle of equity, solidarity, transparency, and accountability. And it's my final word. Thank you.
Thank you very much, Christine. Björn, you are the last. Please share your thoughts with us.
Yes, I think I couldn't agree more with, in particular, Christine. We need a common narrative. When the EU has a common narrative, we are strong. But too often we don't have a common narrative, or we are still working on a common narrative while the others are already creating facts. So we need a common narrative. I think we need a global health strategy, a European strategy, which clearly lays out a common vision, common principles, goals, and priorities, and obviously with a strong focus on constructive multilateralism.
Thank you, Björn. We have come now to the end of the panel discussion, and I would very much like to thank all the panelists, but also all the presenters from earlier today. I would say that we have a very good standpoint to embark on a global health strategy, and also to have more focus on strengthening health systems globally there. We share the values and we have principles in European Union, and we can base our strategy on those. And I think there is a lot to be learned, but of course it's a lot also that we have developed, and many mechanisms that can be used if we think of them in more strategical way. We have heard very clear that we would need better communication, we would need a narrative, common narrative, and we would also need to make our positions clear and negotiate better in advance. Now, I would like to invite all of participants of this conference to look at the draft article that has been prepared by colleagues from Sweden, Germany, and Slovenia. You can find the article on this conference website below the program of today's conference. The article will hopefully inspire us further for the future debates. Strong, resilient health systems and reaching out in the community are some of the guarantees that nobody will be left behind in ensuring access to best possible healthcare and preventive services. Working together globally in this regard will bring us faster to our goal of having more resilient and healthier countries all around the world. And this would be my final message. Thank you very much.
Thank you. Bye-bye.
Bye.
These rivers and streams taught me to dream. The mountains and trees are comforting me. I've tasted the world, but nothing as sweet as all our memories. You're my haven, always there to pick me up when I need to be whole again. There's nothing quite like you, rivers and skies so blue. So I keep coming back to you. Shy and so beautiful, you never leave me cold. So I keep coming back to you. The songs in the caves bring back the heartache. Know how I miss the wine from the hills. Bonfires lit, pour me a drink, love. Let's dream away. You're my haven, always there to pick me up when I need to be whole.